So many of the therapies and approaches to treating cancer have been to treat the tumor cells and stopping them from growing, which is important, but it's not the whole story.
So I'm a physician scientist. I see patients with ovarian, uterine, and cervical cancers, as well as run an ovarian and uterine cancer laboratory.
What we do is, in general, study how cells move. So we're really interested in how all kinds of cells move around your body. And in particular for cancer, this is really important in the spread of cancer. This is a microscope that allows us to image cells in live time. So we can do movies. We can actually watch tumor cells move, so we can control the environment using these different chambers inside.
So when I was a third-year resident, I had a very powerful patient who did not know she had cancer. And so I was the one that told her that she had cancer. And to see that look in her face, to see her husband just not really know what the next steps are, and it was up to me to educate them and to help them understand that, yes, the internet will tell you 3 months, but no, we actually can do better than that because the research that we've actually done, that inspired them and that inspired me to really meld together clinical care and research to be able to provide more patients to have the same feeling. The research I'm doing is looking for how tumor cells actually talk to each other, like what is the language that they use to actually tell each other where to spread and how to spread.
Nowadays, due to incredible advances, very few patients, if any, really die from the primary tumor. Rather, it's the spread of the tumors, or when the tumors move to other organs, and this can cause death. And so how that happens is not well understood. So these are chambers. We can put cells in this central chamber, and then all these ports, you can control the chemical environment, oxygen, mechanical environment. That's how we do this. Katherine is a very talented young faculty member. She came to my lab a few years ago, and the reason she came was to learn some of the experimental techniques we use to understand how metastasis works.
The most important thing I've discovered is these signals, these actual languages. The research that we've done together have identified 18 new signals. And actually 2 of these signals are already in phase 2 and phase 3 clinical trials. So we know that even though we've identified 18 of these, 16 of these are new. No one's seen them before, and we've actually been able to show in our lab using patient tumor cells that if we actually stop these signals, we can actually stop the spread of cancer. It is really cool. It is really cool.
She's extremely enthusiastic, very upbeat. She works extremely hard. The balance between those questions that she asks and the way we think about things, again, we can synthesize an approach to treatment that I think is really effective. Partnering with clinicians who actually have an active research program is critical to bring new discoveries in the laboratory forward. Cancer cells, the way they spread is they spread in groups. One set of cells actually leads the ability of these tumor clusters or groups to invade. And so we've worked with mathematicians and physicists to come up with mathematical models to see if we can predict how those cells will lead the invasion of tumor cells.
This work with Dr. Longmore will help my patients in the future in the sense that his lab is really developing, designing inhibitors to our signals. So we're able to then move these inhibitors from the lab to clinical trials to our patients, and that's what's really going to be the next step. What really drives me to do this are my patients. I'm really not wanting to see another mother, another daughter, another sister, friend come through my office door and die of cancer. Yesterday, I saw a new patient with ovarian cancer, and just seeing fear and anxiety of the unknown just made me want to come back to the lab and just figure out what can we do to keep her living longer. I can tell the patient, look her in the eyes and say, you know, you do have a diagnosis of ovarian cancer, but I know based on what we've discovered that you will see your grandchild in 6 months be delivered. You will see your third daughter's graduation. Being able to do that would be wonderful.